Jeffrey,
Matthew.
Valley Health and Medical Center. So what are you guys doing at Sibec? It's a bit of is this a different space to what you're normally used to, is it?
Yeah, this is definitely a different space. This is my first time at a Sibec event. I've been at a few smaller supplier events that are put on for operators like myself. And I just really enjoy coming here and seeing what's new, especially on the West Coast, getting some beautiful sun, beautiful views behind us, and finding out what's working in the commercial space and how do I take that into a medical fitness center to make us more profitable.
Right.
What's new, what's innovative, and bring that back home to make the best center I can do.
So you have got an amazing center. It's for those of you who haven't seen it, I'd recommend checking it out. I didn't think that medical centers did things like that. You guys must be one of the first to kind of embrace functional training and fitness.
Yeah, I think so. Like I said, it's been a journey. What medical fitness centers do really well is the customer service, the staff engagement, the member experience. But where we kind of lack is the profitability and how do we generate revenue. And that's what's led me kind of on this journey to find out, what are some of the things that I can bring in a medical fitness center and just take it to that next level to increase our profitability so I can bring more unique designs or projects like what we did.
So when people think of medical fitness, when I heard about it, and when you explained what it wasn't quite the same. So in terms of scale, like how big is the site that this is on?
So where this facility is, it's about 70,000 square feet.
Right.
So we have 2 indoor pools, indoor track, 3 studios, about 6,000 members. And they go from age 6 months old all the way up to 100. So what I tell people is it's cradle to grave fitness,
right,
and everything in between.
Now, but it's on the Valley Medical is on a bigger property, is that?
Yes, it's on a 180 acre campus. It's beautiful. Every tree that grows in the Northern Hemisphere is on that campus. I think I kind of told you a little bit earlier. They spend about $2 million in mulch on this property. It's a sanctuary. A year, yes. They bring in these tractor trailers and they blow mulch. It's unbelievable. It really is. But it's part of that overall feeling of wellness that you want to come to a campus that shows life and prosperity and feeling good, because that's where you're going to come and become and feel good. And that's the unique thing about having a $30 million asset in fitness on a hospital campus. It's I tell people we are the front door to the health system, where we're seeing people on the prevention side, seeing them while they're healthy. But what we're also doing is we're building that brand for Valley Health. So when they do need to have healthcare needs, they trust the health system because they've had a great experience in the fitness center. Then I say that it's also the back door to the health system. So where does somebody go after they've had cancer treatment or have gone through rehabilitation services? They come to the wellness center, and in our program we call it's MyFitRx. It's an 8-week program where we transition them back into the center and get them back into the general population.
Right. And just before I get on to what happens in the facility, the building itself is a stone built.
Yeah, it's brick. It's a brick building, and every building on campus is brick. They all look the same. So our building was built 15 years ago, and the new addition that we did together, we had to find the same brick from 15 years ago. So that's it. And it matches perfectly. So it looks like it's been there the whole time. And
you made quite an investment just in the brick alone.
Yes. Oh, yeah. This 6,000 square foot piece that we put in, it was about $2.2 million. Soup to nuts.
Just for the bricks?
Yeah, the bricks, the equipment, okay. Everything.
Right, okay. Mm-hmm. So tell me about the overlap of the medical side and fitness, and because I guess those two things are generally separate. You go to a fitness studio, you go to a medical center, and what we know, and certainly I guess what we've learned recently is there probably needs to be a lot more work in terms of the prevention to avoid you actually needing to go there. So how do you guys view that wellness journey that you've kind of touched upon just a moment ago?
Mm-hmm. Yeah, I think it's, like you said, it's a journey. And it's, What we've been able to do now at this facility is, bring in a different demographic that we weren't able to serve. We were mainly an adult facility with an average age of 55. By adding our new functional training space and with COVID, it's really highlighted the importance of exercise for the general population. And so the way that we view it is, in a medical fitness center, we do a really good job with the 80% of the population that don't go to gyms. I think 80% of my members are first-time gym goers. But what we didn't do a very good job of was the 20% that are active exercisers using more of the commercial facilities. And so we wanted to figure out a way to engage those individuals so that we could have that cradle to grave fitness.
Right. And do a lot of the clients that you get in fitness then, are they general referred to once they've been through so what's the main entrance point into?
Yeah, so the main entrance point is it's very similar to your commercial facilities where they're either coming in or we're generating leads. But the unique thing is we do get referrals from the providers. One of the unique things that we have in our facility is we've integrated in our medical health records. So we use something called Epic. And so our providers that are on Epic can send us an automatic referral to the center. My sales team gets a hold of them, gets them into this MyFitRx program, and we get them into the program. And after about 8 weeks, we see a transition rate of about 82% into general population. The unique thing about it, actually, Matthew, is that my average length of stay for my general population is 24 months. For this MyFitRx, it's 36 months. And it's an amazing program. Like I said, it's an 8-week program. They get an intake and a discharge, 14 supervised sessions, 2 registered dietitian sessions, and full access to the gym for 2 months for $99. And people say, how can you afford that? We don't make money on that. Where I make the money, actually where we actually achieve the mission, is we keep them for 36 months in a fitness center, allowing them the chance to reach their goals.
And how do they continue evolving their knowledge and their programming and their motivation once they've finished the initial program? Mm-hmm. Do you provide them with additional support, or do they have a pathway they can work with a trainer or anything like that?
So that's one of the unique things, is those individuals that are working with them are our personal trainers, our fitness specialists. In our facility, we always have a fitness specialist available at any time for any questions. So any member can come up and talk to them, help them with any kind of machine or exercise component. Or if they want to continue with personal training, we encourage that, because we know that's the way that they're actually going to see the results. It's not once they're done with the program, it's over. We constantly are doing reassessments, and we don't charge for that. We're all about trying to gather as much data as we can, so that way we can share it with them, they can share it with their family, they can also share it with their providers.
Right. So in terms of data, this is something we've heard quite a lot recently. Have you been able to create any data that demonstrates the people that you're getting on the program, how their general health and wellness is compared to people that are not on it? Like, is there any sort of measurable difference to say, look, these people that are coming into these fitness centers are just, they're not getting sick as much, or they don't get these diseases or anything like that?
Yeah, that's kind of the holy grail, really, when it comes to it. But there was a study done at a facility in Canada called RayFit. Now it's socialized medicine, so everybody has to use that healthcare system. So they were able to see the individuals that were using their medical fitness centers and the individuals that weren't. And over 10 years, I think they were able to show that the mortality risks decreased with those who used a medical fitness center from those that didn't use that. And that would be in regards to really any fitness. So, the term we always hear is exercise is medicine. It really is medicine.
Right. And is that something that you guys are going to try and continue to get that data so that you can demonstrate?
Yeah.
Right.
So I'm the chairman of the board of directors for the Medical Fitness Association, and that's one of the initiatives that we have in our outcomes task force, is trying to gather information from the medical fitness centers in our association to show that, and then maybe down the line that helps with the reimbursement aspect into fitness. Showing these certified medical fitness centers provide better outcomes, so maybe we can get reimbursement as that. Right. That's kind of the buzz thing that's going on right now that I'm hearing from ACSM as well.
Is there many places across the country that are doing similar things to what you guys are doing?
Yeah, there's about, I think, identified 2,400 medical fitness centers around the country. Not all of them are part of the association, though we would love to have them as it, because the bigger the amount of folks that we have, the more that we can attract to it. And so that's one of my goals as the chairman of the MFA, is to show that even if you don't do medical fitness, medical fitness is everywhere right now. Everyone's talking about it. It's the buzzword. I tell people we've been doing it before it was cool. We've been doing it for 30 years in medical fitness. But I think that's how we can show the commercial facilities, some of the things that we do that they can incorporate so that they can become medically based and still be commercially based as well. I think that's a unique opportunity that COVID has identified for us. And that's what I'm trying to do.
All right. Final question. What have you come to Sibec looking for? Did you have any particular goals or outcomes, or was it just a case of meeting new people and seeing what's out there?
Yeah, I mean, I think that's a big part of it, is seeing what's new, what's innovative. I think life's all about relationships, and the more relationships you can create, I can maybe plug somebody into somebody to help them out. They can help me out. It's just, I wanted to come and meet you personally. I did.
Thank you.
And it's a unique opportunity that I have in front of me, and I was very happy that Crystal and Marty invited me out here to be part of this, and it has not let down.
Fantastic. Well, Jeffrey, thank you very much for your time.
Thank you,
Appreciate
Matthew.
it.
Yeah, thank you.